Welcome to the deep dive. Today, we're really getting into the details of depression and anxiety.
That's right.
I've gathered info from the CDC, the Cleveland Clinic, and also WebMD.
Good sources.
Our goal here is basically to pull out the most important pieces for you. Think of it as a way to understand what these conditions actually are, how they show up, how they might be connected, and importantly, what help is out there. We want to make it clear without getting totally bogged down in jargon.
And I think it's really crucial right at the start to say that feeling sad sometimes or worried, that's completely normal. It's part of being human.
Yeah.
What we're focusing on here is when those feelings stick around and, start to take over your daily life.
Okay, so let's dive right into depression then. It's definitely more than just having an off day or a bad mood.
Right.
The CDC really stresses that it's this persistent sadness that actually gets in the way of you functioning day to day.
Precisely. And there's a whole range of symptoms that can point towards depression. The CDC lists things like feeling sad or anxious or even empty pretty often.
A loss of interest too, right? In things you usually enjoy.
Exactly. Loss of interest is a big one. Or maybe feeling more irritable or restless.
And it's interesting because it's not just feelings. There are physical things too.
Oh, absolutely. Sleep is often affected too. You might have trouble sleeping or sleep way too much or wake up super early and not be able to get back to sleep.
Okay.
Then there are changes in appetite, eating more or less or having no appetite at all. Even unexplained physical stuff like aches and pains.
And difficulty concentrating, making decisions.
Yeah, definitely. Trouble focusing, remembering things, making choices that used to be simple. Feeling tired all the time, even if you have slept.
Wow.
And emotionally, there can be strong feelings of guilt or worthlessness, maybe helplessness.
And in serious cases, thoughts about suicide.
Yes, and that's incredibly important. Thoughts of self-harm or suicide can happen. And we really need to stress, this isn't for self-diagnosis. If this sounds familiar, talking to a doctor or mental health professional is so important.
Right. So what actually causes depression? What are the drivers?
Well, the CDC says the exact cause isn't totally nailed down yet. It seems to be a mix of things.
Right.
Like genetics, if it runs in your family, your risk might be higher. Biological factors, brain chemistry, basically. And then environmental things and psychological factors, too.
And I guess certain life events can play a big role, can act as triggers.
For sure. Things like trauma or really stressful events, abuse, losing someone close, major money problems, those are known risk factors.
Okay.
Even big life changes, the kind that throw everything up in the air. Certain medical problems too, like cancer or stroke or dealing with chronic pain.
Right.
And even some medications or using alcohol or drugs can increase the risk.
It just strikes me how common it seems to be, maybe more than people think.
It really is. The CDC figures suggest about 1 in 6 adults will deal with depression at some point.
1 in 6.
Yeah. And in any single year, that's around 16 million adults in the U.S. It's crucial to get that depression can affect anyone, any age, any background. It doesn't discriminate.
Okay, let's shift gears a bit and talk about anxiety disorders. How are they defined? The Cleveland Clinic had some insights here.
Yeah, they describe them as mental health conditions where you feel fear or dread or other symptoms that are kind of out of proportion to the actual situation.
Like an overreaction you can't control?
Pretty much. You might feel like your reactions are just too intense and you can't dial them back. The Cleveland Clinic breaks down symptoms into psychological and physical ones.
Okay, what are the psychological ones?
Things like intense panic, feeling really fearful or full of dread, a constant sense of unease, feeling keyed up, on edge, irritable. Also, having thoughts you can't control, maybe obsessive thoughts, and finding it hard to concentrate.
And the physical side? I know people talk about heart racing.
Exactly. That's a common one. Restlessness, heart palpitations, feeling short of breath, like your chest is tight.
Muscle tension too?
Yep, muscle tension, cold or sweaty hands, dry mouth, nausea. Sometimes even numbness or tingling. And like depression, sleep problems, insomnia is really common with anxiety.
And it's not just one single thing called anxiety, is it? There are different types.
That's right. Both the Cleveland Clinic and WebMD talk about several types. There's generalized anxiety disorder, or GAD, that's sort of constant excessive worry.
Okay.
Agoraphobia, fear of situations where escape might seem hard. Panic disorder, which involves unexpected panic attacks.
Phobias too, right? Fear of specific things.
Yes, specific phobias, intense, irrational fear of, say, spiders or heights, social anxiety disorder, fear of being judged in social situations, separation anxiety disorder, anxiety about being away from loved ones, and selective mutism, where someone doesn't speak in certain situations.
What about OCD and PTSD? Are they anxiety disorders?
Well, they definitely involve anxiety, but they're often classified separately now. And just to give a sense of scale, the Cleveland Clinic notes specific phobias alone might affect up to 12% of people. So these are really common.
So what's behind anxiety disorders? Similar factors to depression.
There's definitely some overlap. The Cleveland Clinic mentions chemical imbalances in the brain neurotransmitters like serotonin, dopamine, GABA, norepinephrine getting out of whack. They also talk about possible changes in brain structure or function, like maybe the amygdala, the fear center being overly active.
And genetics.
Environment. Yes, genetics seem to play a part. These things can run in families. And just like with depression, environmental factors are big. Severe or long-lasting stress, experiencing trauma, those can contribute.
Okay, this is where it gets really interesting for me. The connection between depression and anxiety. The sources seem to agree they often happen together.
Oh, absolutely. Comorbidity, having both at the same time, is very common. WebMD estimates something like 60% overlap.
60%, wow.
Yeah. So many people with anxiety also have depressive symptoms and vice versa. They even share some symptoms, like feeling agitated or restless.
Makes you wonder what's going on underneath, right?
It does.
But they are distinct conditions. How do we tell them apart?
The core difference, according to WebMD, is the main feeling. Depression is mostly about that persistent sadness, losing interest, lack of energy.
Right.
Anxiety is primarily about excessive, uncontrollable fear or worry, often about future stuff.
But I could see how one might feed into the other.
Definitely. WebMD brings that up. Like, if anxiety makes you avoid situations you fear, that could lead to isolation, feeling hopeless.
Which sounds like it could edge into depression.
Exactly. And there might be shared biological roots too, similar genetics or brain chemistry vulnerabilities that make someone prone to both.
The CDC also brought up smoking, the link between smoking and mental health conditions. That felt important.
It really is. The CDC data shows smoking is much more common among adults who have conditions like depression or anxiety.
How much more common?
Significantly. They estimate about 3 out of every 10 cigarettes smoked by adults in the U.S. are smoked by people with these conditions.
3 out of 10. That's huge. Do we know why?
The CDC says the exact reasons aren't totally clear yet. More research is needed there. But the absolutely critical point they make is that smoking is not a treatment. It doesn't help depression or anxiety in the long run.
Right. So quitting is actually better for mental health.
Yes. Getting the right support for mental health and quitting smoking, those are the paths forward.
So for someone struggling with either or both of these, what kind of help is available? What are the treatments?
The good news is there are very effective treatments. Generally, it involves therapy, medication, or often a combination of the two. All the sources, CDC, Cleveland Clinic, WebMD, point to this.
Okay, let's talk therapy first. What does that look like?
Therapy or psychotherapy, talk therapy. It focuses on your current thoughts, feelings, behaviors, as the CDC puts it. The idea is to learn coping skills, change patterns that aren't helping, find solutions to problems.
Are there specific types that are common?
Yes. Several are really well established. Cognitive behavioral therapy, CBT, is a big one. It helps you identify and change negative thought patterns and the behaviors that go with them.
Okay.
There's exposure therapy, often used for anxiety or phobias, where you gradually face the things you fear in a safe way. Interpersonal therapy focuses on relationships and communication. And problem-solving therapy helps you manage symptoms by tackling stressors directly.
And medication, what's used there?
For depression, antidepressants are very common. You hear about SSRIs, selective serotonin reuptake inhibitors,
Right.
and SNRIs, serotonin norepinephrine reuptake inhibitors. Basically, they help adjust brain chemistry related to mood.
Yeah.
There are others too, like bupropion or mirtazapine.
Do they work right away?
No, that's important. They usually take a few weeks to really kick in, and you absolutely shouldn't stop taking them suddenly without talking to your doctor. The CDC and Cleveland Clinic both warn about withdrawal effects.
Okay. What about meds for anxiety?
Antidepressants are often used for anxiety too, actually. Sometimes doctors might prescribe benzodiazepines for quick relief of severe anxiety. But the Cleveland Clinic notes they have risks like dependence, so they're usually just for short-term use. Beta blockers can sometimes help with the physical symptoms like a racing heart.
And it sounds like telling your doctor about everything you're taking is key.
Absolutely crucial. Prescription meds, over-the-counter stuff, even nicotine patches or gum if you're trying to quit smoking. Your doctor needs the full picture to avoid interactions.
Beyond therapy and meds, what about lifestyle? Can that make a difference?
A big difference, yeah. WebMD and the Cleveland Clinic both highlight things like regular exercise. Getting moving is really beneficial.
Relaxation techniques, too.
Definitely. Yoga, meditation, deep breathing exercises, finding ways to calm the system. Diet matters, too, focusing on lean protein, healthy fats, fruits, veggies, and maybe limiting sugar, caffeine, alcohol, processed foods.
And support systems.
Hugely important. Friends, family, support groups, connecting with others who understand or can offer support makes a real difference. And circling back to the CDC point, if you smoke, research shows quitting can actually improve mental health over time and won't mess with your treatment.
It's also vital to know where to turn in a crisis, isn't it?
Yes, absolutely critical.
Okay.
If you or someone you know is thinking about self-harm or suicide, please reach out immediately.
What are the resources?
You can call or text 988 anytime in the U.S. That's the National Suicide Prevention Lifeline, available 24/7. You can call 911 or go straight to an emergency room.
Okay.
Contact a mental health provider or your regular doctor, or reach out to people you trust, friends, family, spiritual leaders. Don't wait.
The Cleveland Clinic also had some specific self-care tips, particularly for anxiety.
They did. Things like actively using stress management techniques, meditation, breathing, mindfulness, exercise, making them regular habits.
Support groups again.
Yes, finding support groups, whether they're in person or online. Listening more about anxiety itself can be empowering. And they also suggest limiting or avoiding caffeine, since that can really ramp up anxiety symptoms for some people.
It really sounds like not getting treatment for these conditions can have some serious consequences down the line.
It really can.
Yeah.
The Cleveland Clinic warns that untreated anxiety and depression can lead to problems with relationships, social isolation, just a lower quality of life overall. It increases the risk of substance use problems, potentially developing major depressive disorder if it wasn't already there, and even, interestingly, a higher risk of heart problems.
Wow. So getting treatment is incredibly important.
It is, and the encouraging part is that treatments are effective. They can make a huge difference in your quality of life, your relationships, your ability to function and feel well.
Okay, so wrapping up the key things from this deep dive. Depression and anxiety, they're distinct, but wow, they often show up together.
Very often.
They come with a wide range of symptoms, both mental and physical. Causes are complex, a mix of biology, genetics, environment.
Right.
But importantly, there are effective treatments, therapy, medication, lifestyle changes, and that idea that smoking helps. It doesn't. Quitting can actually be beneficial for mental health.
And I think the biggest takeaway really is if anything we've talked about today resonated with you, if you recognize some of those experiences, reaching out for help is a sign of strength.
Yeah,
It truly is. It's the first step and often the most important one towards feeling better.
absolutely. On that note, here's something maybe to think about as you go through your day. We know there's this really deep connection between our minds and bodies, right? So what's one small thing, one tiny step you could maybe explore today just to nurture your overall well-being? Could be as simple as taking a few mindful breaths, stepping outside for a short walk, or maybe just pausing to honestly check in and acknowledge how you're feeling right now.
That's a great thought to end on.
Thank you for joining us for this really important deep dive.